right, hi Annette, how are you?
I'm great. How are you?
Good. So today I'm going to be going over with you the Papr device training, okay?
Awesome.
So I'm
Thank you.
going to show you how to assemble the Papr, how to use the Papr, as well as how to clean the Papr when you're done using, okay?
Great. Thank you.
All right, so there are Papr instructions that are included in every Papr device. This is step by step on what I'm going over today, so you'll have it as a reference. No need to try to remember everything I'm saying today, okay?
Got it.
All right, so Papr devices are kept on the first floor in our distribution department. And when you go and pick up a Papr, we ask that you perform 2 steps prior to bringing it to the patient care area. We want you to do a visual inspection of the device and do a couple safety checks. This will ensure that when you get the device upstairs to take care of a patient, it is functioning appropriately. Okay? So the first thing you want to do is a visual check. You want to make sure that the device motor itself is intact, it's not broken, that it doesn't look like it has been through the ringer. The next thing you want to do is make sure you have all of the equipment that you need. You definitely will need airflow tubing. You'll need a battery, which we'll talk about in a second, and you'll need your airflow checking device. So that is my visual inspection. The next step, I'm going to do my safety checks, okay? So part of the visual inspection is your battery. You want to make sure that you have a battery that has enough charge to care for your patient. So how do I know if my battery has enough charge? There's a button on the back of the battery that says test. Once you press the test button, it will illuminate and let you know how much battery. A full battery will last 6 to 8 hours, okay?
Got it. Thank you.
My recommendation is anything 2 or less, then you get a new battery before you go into your patient's room, just to ensure safety. So first thing, let's go ahead and place on our battery. You do one side at a time and you push to click. All right. So now I'm ready to perform my safety checks. The first safety check is airflow. You want to make sure that this device is going to give you the positive pressure airflow that's required to keep you safe. So there's an airflow checking device. You attach it to the motor directly and you turn the motor on by pressing the blue button at the top. When you hold it upright, what you want to see is the ball levitate all the way to the top. Once the ball reaches the top, you can consider that a pass test. To cut the device off, you hold down the power button for 3 seconds. All right, safety check number 1 is passed. The next safety check is you want to make sure that this device will alarm you if something goes wrong. If there's a kink in your tubing, if your hood is not placed correctly, if the airflow cannot do what it's expected, it should alarm. So let's test that. To test, you would simulate the problem. So let's simulate a problem by occluding the airflow several times. And we're looking for an alarm to sound. Okay, once you hear the alarm, you pass the test. So now this device has passed both safety tests as well as our visual inspection. We can now take it upstairs to our patient care area and use it, okay?
Right.
The next thing we're going to talk about in med today is going to be our hoods.
Okay.
So throughout the facility, we currently have 2 different types of hoods or styles of hoods. There's a style of hood that has the ear loops where your ears are exposed. The second type or style of hood does not have the ears exposed, and it also has a drape or a skirt that's kind of attached to it, okay?
Got it.
Now, the different style does not change the functionality or the safety of the hood. It's just 2 different styles, okay? The styles come in 2 different sizes, small, medium, and medium large. Size does not equate safety. It equates more comfort, okay? So whatever fits you best, that's what you should go with. All right, and so let's talk about cleaning the hoods. So the hoods are made of an impermeable material that can be deconned or cleaned and wiped off indefinitely unless it is visibly soiled, ripped, torn, or after so many wipes, it can be, the material can degrade a little bit. So you want to keep an eye on that. If that happens, before you throw it away, we're asking that you please notify your nurse manager or safety before you discard so that you can get a replacement hood, okay? Another thing to note about the hoods, there is a gray band. This is not a headband, it's a forehead band. So when you place the hood, it should rest right on your forehead. This ensures that your face and your mouth are not pressed up against this window, and you will get the appropriate airflow and circulation, okay?
Got it.
So we'll do that in a little bit. The next thing we're going to talk about is assembling the Papr device itself. So we already have our battery intact because we performed our test. Another thing we want to make sure is that before we use this device, we have a filter. How do I know I have a filter? I see purple writing, okay? And usually you may see, or you should see, an expiration date. These filters are good, continuous use for 6 months, okay? So you should have a 6-month or expiration date that's visible on your filter. So I'm going to go ahead and put the device on so that we can talk about assembly, the rest of the assembly. The belt is adjustable for just about any waist size, so you can adjust it there. Your airflow tubing. So the first thing you want to put on is your airflow tubing. There are two sides. There's a large mouth side and there's a small mouth side. The small mouth side has silver prongs. The prong side goes to the motor. So you line up the notches and you turn to the right. And you give it a little tug just to ensure that it's a nice fit, okay? The second thing you want to apply is your hood to the large mouth side. To attach, you push until you hear a snap. When you're ready to remove, you press the blue band and it removes. So you push on to snap. Now you have assembled your Papr, okay? And now at this point, you're ready to go in and take care of your patient. So next thing we're going to talk about is the proper way to don and doff your PPE when you're wearing a Papr device. The first thing to note is Paprs go first. So your Papr goes first. So first we're going to put on our Papr. I'm going to put on my hood, ensuring that the gray band is on my forehead. Yep, I can feel it. Feel it on. Making sure the chin strap, there's a tab here where you can adjust the chin strap. And now I'm going to cut my motor on. Very important. Please do not put your Papr hood on and not cut your motor on. You won't last long, okay? Okay, so we've got air circulating. This also gives you an opportunity to tell, is there a kink in the back? So now you have your airflow. You don't want to put this on and run in your patient's room and then turn on the motor. This gives you an opportunity to make sure that things are working properly, making sure that you have a nice seal and it's positioned right, okay? The next thing I'm going to do is put on my yellow gown. Now prior to doing this, I should have performed hand hygiene for a minimum of 20 seconds, okay? Please don't forget your hand hygiene, guys. All right, put on your gown. And if your gown comes with thumb straps, please utilize them. I'll tell you how important they are in just a bit. The next thing, after my gown, my gloves. So as a recap, when donning your PPE, Papr first, gown second, gloves last.
Of course, the gown will be tied all the way.
Yes, the gown would be tied. You can tie your gown around. Yeah. So you tie your gown. Now you're ready. Okay, so I've got my Papr, my gown, and my gloves. I'm ready to go take care of my patient. When I'm done caring for my patient, then I want to remove everything in the reverse order. The first item that's going to be removed are going to be my gloves, okay? So you want to remove your gloves inside out as not to contaminate any surfaces and discard in the trash. The next thing you want to do is remove your gown inside out, so I'm going to untie first. Okay. I'm going to use my thumb holes to help me remove my gown inside out and away from you. Okay, so that's the goal, inside out and away from you, as not to spread any contaminants, discard in the nearest trash can. Now you have no gloves, no gown. Your Papr device is still running. You should grab a new set of gloves. purple wipes. Now, bleach wipes are not recommended unless there's seated precaution in place, and that's when you should use your bleach wipes, okay? Give your hood, your airflow tubing, as well as your device a quick wipe down, okay? Give it a quick wipe down. Cut your motor off by holding the button down for 3 seconds. You are now ready to remove your Papr. Use your chin strap at the bottom to pull up and away from your face. You can disconnect your device, place it on a table, and now you're ready to give the good decon cleaning, okay? So you're gonna take your purple wipes. I always like to detach my hood because I want to give the machine some good attention. And you want to get the surface nice and moist, taking into consideration the dwell time, okay? The recommended dwell time for the purple wipes. And you want to clean the airflow tubing really well. You want to clean the device, the battery, as well as the belt. Give it a good clean. Place it back in the container. Then you move over to your hood and you give your hood the same type of wipe down, okay? Also utilizing that dwell time. Okay, these will be left to dry and ready for my next patient assignment. That concludes our tutorial.
All right.
After doing that, definitely want to do some hand hygiene, at least 20 seconds.
All right. Thank you very much.
You're
Could
welcome.
you touch base real quick on hand hygiene in between removing the Papr?
Sure, absolutely. So before you get started, you definitely want to do hand hygiene. Once you remove your gown and your gloves, if you happen to be in an ante room that has the capabilities of hand washing, you can wash your hands there, or you can use the Purell sanitizer cleaner, and then you can don a clean pair of gloves to start the decon process. Okay, and then when you're done, of course, after leaving the patient's room, you do hand hygiene.
Awesome. Well, thank you very much for the excellent demonstration. I think I will be able to utilize this as a resource if I have any questions while I'm taking care of our veterans.
Absolutely, absolutely. And any questions after the video, please feel free to reach out to myself or Emmanuel Easterling, who's our safety hygienist, and we'll be able to answer any questions for you.
Thank you very much. I
Thank
appreciate
you.
your time.
Have a wonderful day.
You too.